so Tony, it'll be a lot easier.
This is how I listen too. I'm
oh, yeah, sure. No, I love it. Yeah. I can definitely send it to you. No worries.
Please.
And so it takes 22 seconds to get to the brain and start working. That's very, very fast. But the rule with essential oils is fast in, fast out. Okay? So it's going to be the fastest to metabolize through the system. The second way to do it, which is the way I normally do it, is topical application. Okay? The soles of your feet are a great point to put oils. Okay? The soles of your feet, like before bed, and then because you're laying flat, your feet aren't walking on stuff, the soles of your feet. The neck, right into the carotid artery, bloodstream there, goes right into the brain from there. The wrists, because it's got thin skin there and blood vessels, can get right into the bloodstream from there. Okay, a lot of different areas there, about 2 inches below the navel, also a really good spot. Or either side, spleen or liver, okay, either one of those. You don't want to put it on an area that has a lot of fatty tissue or muscle tissue on top of it, like the chest or something like that, yeah. But that's where
Don't put it on your lips then.
Oh, no, okay, good point though. Don't put it on your lip, don't put it anywhere sensitive. Underarms, any private areas, it will burn. Don't do that. It's all natural, yes, doesn't matter. So is molten lava out of a volcano. But just because it's natural doesn't mean it's okay for us to touch it. Yeah. So don't put it anywhere soft, ever. Yeah, good catch there. Good catch. We learned that the hard way, all right?
Oh God, no,
now,
God,
the
no.
timetable for that one is about 2 minutes into the bloodstream. Skin is 2 minutes, 22 seconds is when you inhale it, okay? And then the last way, and this is only done with certain oils like black seed oil, rosemary oil, if you put it on a salad or something, you can ingest some of these, not all, but some. You can ingest, and the ingestion, it takes anywhere from 30 minutes to an hour for it to get into your system because it has to go through the digestive process and go from there. Now, the duration effects, when you inhale it, you have about 2 to 4 hours before it's out of your system, okay? If you put it on your skin, you have 4 to 6 hours. So let's say, for example, if I wanted to literally not age for a day, according to science, I would use rosemary oil 1 to 2 drops over a different part of my body once every 6 hours. That'll literally slow down the aging process to a crawl and possibly reverse it just a tiny bit. Okay, but that's what the science says, and that's what our real life results say as well. Ingestion, which is going to be the slowest way in, but it's the slowest way out. So if I wanted to put rosemary on a salad or something, or put it maybe in some apple juice or something like that, I'd probably go with salad. But then it would be in your system for up to 8 hours, so you'd only have to consume it 3 times a day. 1 to 2 drops 3 times a day. All right, that's how those work. Now we're going to get into some scary stuff, but this is important information because this is the type of stuff that we're going to move into that saves lives, and then we're going to transition into these wonderful superfood powders, which I really get excited about. I just like to get the essential oils out the way up front because they're really awesome, and it doesn't take a long time to tell you everything you know. Fair enough? Any questions so far?
No, sir.
Wonderful, thank you. Okay, now this is anything I'm about to tell you. Feel free to Google it, grok it, research it, do your own research on this stuff. I've done it a million times, but this is the real numbers as of today. Okay.
And you have some people that some good like.
Oh yeah.
They have
research. They are
yes.
They are experts.
Yes. So they have told us some things, and it's like
good.
We know our people. So, and we know Charlene, and so this is good. This is good. So,
Charlene.
I know. So like we believe you. Like so, thank you for saying that. But
you're welcome.
We're ready.
I got you.
We're
Okay.
ready. Yeah.
Got it. Okay. Medical errors kill between 250,000 and 400,000 Americans every year. Just Americans. And that's not on purpose. That's accidents. Okay? It's accidents. Like, sorry, I didn't mean to do it. Okay? Now, research would suggest that because the number's so high, imagine if American Airlines accidentally killed 250,000 passengers a year. Would anybody ever fly?
No.
Never.
They freak out if there's like 2 planes within like 6 months or something. Because they just never crash. So then you get 2 in 2 months or 2 in 6 months.
Imagine if law enforcement, I was in law enforcement 10 years. 10 years. Imagine if law enforcement this is not the on purpose stuff, like gunfights with the cartel. No. Imagine if law enforcement accidentally killed between 250,000 and 400,000 people a year. If cops accidentally kill one person, they're trying to shut down half the country. Losing their mind, going crazy. I'm like, can y'all settle down? That's one human who may or may not have been a criminal. We don't know. But my point, never made it to court. We don't know. But my point is, imagine a $250,000. I mean, come on. But doctors accidentally do this.
Yeah, more than we know.
And we don't bat a lash. Now you need to really think about that. But why? Because if in medicine, nobody's going to talk about it. Now, here's one of the crazy statistics. I didn't even want to believe this myself. 99% of orthopedic spine surgeons will be sued for malpractice at least once. Literally, 99%. So if you ever have to go to an orthopedic spine surgeon, just understand, it just might be you or the next person or the next person. But somebody's going to get messed up. 99%. Yeah. And that's scary. Imagine if every pilot got sued at least once for crashing a plane. Every pilot. 99%, you'd never fly. We would never fly. But we go to the hospital just because. Let's just go. Because why not? I feel a little off today. Let me go. I want to do things that will prevent me from, if I have to go, like surgery, broke arm, car wreck, like, if I gotta go, I gotta go. I just don't want to go for regular stuff. Check up, that's it. I don't want, because I know that 250,000 people are going to go in there and not come out. Okay, and I'm gonna give you some examples, real life stories of various ages. It's not old or young or white or black or male or female. Everybody can get got. Okay, but I'll give you some real stories about it. Okay, so the real epidemic wasn't COVID. COVID doesn't kill 250,000 people a year, but we were shutting down schools and shutting down this. You got to wear a mask. The regular hospitals doing that every year for as long as we've been going. Just look it up. Okay.
I don't know.
Now, we want you to protect yourself. Okay, and your family with these products, and this is going to really help you, but I want to give you the science and research behind why they work. Oddly enough, one survey reported that 69% of doctors admitted to misusing prescription drugs at least once. So if they admitted to doing it at least once, we know the number's higher than 69%, which is crazy to me, but that's the facts, okay? 40% of doctors under 40 admitted recreational marijuana and or cocaine use. Doc,
I believe you. And if you have the money, you have the means, you have the
doctors, right? But this is what happens when that's the culture and we're never told about it, because I'm not a doctor. I don't know doctors like that. Okay, the ones we know are really cool people. They really try hard. But the numbers are what they are. In Minnesota, what was meant to be a routine spleen removal surgery, they call it a splendectomy. Like for example, I don't have an appendix. I didn't know I needed that. Turns out I do. But at the time, many years ago, I didn't know anything about research, science, nothing. The doctor said, "Yep, got to take that up." Like, okay. Didn't know any better. Oh, that's inflamed. That's got to come out. I didn't know. Right? So this person, I'm sure they got the same thing. The surgeon accidentally removed the person's left kidney instead of the spleen. Oh. The error was compounded by a post-op note that falsely stated that the spleen had been removed. In reality, the kidney was gone and the infected spleen remained untouched. That woman is still alive today. She was in the hospital for 2 months. She's now on stage 5 kidney disease and requires dialysis 3 days a week for 3 to 5 hours a day. Nothing she can do about it. Try to sue him. Try. Right? There's another doctor. This doctor was in Texas. I lived in Louisiana, then California, then Texas, then Florida. But when I lived in Texas, there's a doctor in Texas, Dr. Christopher Dunch. Never met the man.
Oh, yeah.
But in 2 years,
he killed a bunch of people.
He sure did.
He's the back surgeon.
We watched the, we watched about him.
True story.
He's a nutbag.
Yeah,
he is. But that was him.
He was narcissistic.
He's still trying to get his license back. He still thinks he's a good surgeon.
The fact that they would even consider allowing that is not surprising. Not surprising. So we'll skip his story.
Yes,
Y'all know what that's about.
No, it's terrible.
We're gonna move past those.
God. He's a murderer.
Yeah, no, literally. Yeah, literally.
Yeah.
He, I don't know if this. I'm sure they talked about it on the show. I'm sure. But in his first 2 years, he either killed or maimed.
Yes.
He killed everybody. 31 patients.
And his best friend.
2 years. And his best friend. Yeah,
and his best friend.
That part's true.
And his best friend.
Yeah, which is crazy. So just imagine if the construction industry, just imagine buildings that were built were just collapsing and killing 250,000 people a year.
Nope.
We would hang the construction industry. All of them. Like, no, 250,000. That's a lot of people. That's more people in the Vietnam War in total.
Yep.
In total. In 1 year. That's what the medical industry does. So when you think about putting those numbers into other scenarios, it becomes unthinkable. But this is literally kind of what it is. Now, the age doesn't matter. Remember I told you that. So there's another young lady in Texas. This was Jadalyn Allen, 6 years old. Okay? She had sickle cell anemia. Can't do much about that. Born with it. And we get it. The pharmacy. You got to watch the meds too now, apparently. The pharmacy created a solution for her that was 10 times stronger than what was prescribed. She died within 24 hours of taking it. And the sickle cell normally doesn't kill you. Sickle cell doesn't normally kill you. They know how to treat it, and you'll be okay.
You live with the pain. I had taught a kid, and he was small in stature, and he'd go in the hospital. But like you live with the pain, but then you get through it. He would take treatment, and he get better. And
but you don't die.
No, you just have to live with it.
The pharmacist got it, not the sickle cell, and that's the sad part, right?
Yeah.
That's it.
Yep.
2-year-old. Emily Jerry, Rainbow Babies and Children's Hospital in Cleveland, was receiving chemotherapy for a tumor, non-fatal. During her last treatment, she was almost done. Almost got to ring the bell. The pharmacy tech mistakenly compounded a solution with the wrong amount of saline. It made it 26 times stronger than intended. The supervising pharmacist failed to catch the error because you have checks and balances in place. You got to check everything. They didn't catch it. The solution was administered. She went into a coma that evening, and 3 days later, she was gone. Okay? But it doesn't matter. Bessie Neiman, 39-year-old, health columnist for the Boston Globe, mother of 2, very popular young lady. She was getting not even a stem cell transplant, which is not necessarily a bad thing. Stem cells are really good, apparently, for you to get those. Doesn't matter. Tragic medication error. She was apparently administered chemotherapy drugs instead of the regular stuff she was supposed to be getting, and she died. Just as she was nearing discharge, her heart failed as a result of the chemotherapy drugs. Yeah, so that was a wrap on her.
Stem cells, chemotherapy.
I know, we know firsthand, which is mom, went into the hospital, she had an aneurysm in her belly. Mm-hmm. She needed blood. Mm-hmm. We were giving her blood pre-operatively.
Right.
We gave her wrong blood.
What you mean?
You're supposed to check that blood 7 times before. There's 7 different
Gave
times.
her the wrong blood
different
type.
People. They gave her the wrong blood. They gave her
she
was
needed
A,
or
Oh my God.
Yes.
I did not know that.
That's a big issue. Oh my God.
Almost
See, both of my grandmothers, one lived to be 99. She was stout. She went into the hospital, never came out. We don't know what happened. Something wrong. We don't know. Something. Who knows? Who knows? Like whoever really knows. Right?
Yeah.
God knows.
Yeah, see that. Amen. That's true. So the way that how do we fix that? Well, we're going to talk about that because if we can just figure out how to prevent, there are some stuff we can't prevent. It's true, but some stuff we can. And the things we can prevent, if we can do that, we are 80% less likely to ever have to go to the hospital. Yep. So we're 80% less likely to be in that number of people, and all of us have been affected in one way, shape, or form. Someone we know, or we know someone who knows who went to the hospital and never came out. Okay, that's just, it happens. Now, the way that this stuff works is we have a mission to want to get healthy. Now, there are tons and tons of autopsies, and autopsies are things that doctors who are really sharp can learn from. So the information I'm about to give you is information that doctors did that they discovered during autopsies when people pass away from certain ailments. They can check everything in their body and see what they had and what they didn't and things of that nature, okay? Let's see, here we go. And this is where the products fit. So I'm not a doctor. I'm not claiming that the products treat, cure, or prevent any disease. I have to give you the disclaimer, but I'm going to give you actual research that you can look up yourself, okay? Now, in 50% of cases, let's talk about epilepsy. All right, when people get the seizures and the flashing lights, I know people that have that. Now, if you look up what causes epilepsy, most research, or most Google searches anyway, will show you that it's either genetic, either born with it, it's epileptic, kids, right? Brain injury, a brain injury that you know about, a brain injury that they didn't know about, like, oh, he must have fell when he was young and nobody knew and it did something, right? Perinatal trauma, something happens when it's in the womb that causes epilepsy. Infections can cause epilepsy. But in 50% of cases, no clear cause is ever known, and that is called idiopathic epilepsy. So remember that word. Idiopathic means we don't know. We don't know what causes it. You're going to hear that a lot, okay? Now here's the thing. Over 3,000 autopsies were done, and a lot of those were people who died, but they happened to have epilepsy. And they had one thing in common. Every individual, with no exceptions, who had epilepsy, when they checked their bodies, had a calcium deficiency and a magnesium deficiency 100% of the time. So I said, let's look into that. Like, I need to look into that, and why is that? Well, I'll tell you. Calcium, apparently, if you have a calcium deficiency, low calcium, it is going to destabilize the electrical activity in the brain, and it's going to lead to seizures. Magnesium works with calcium to calm nerve signals. Without magnesium, the brain can short circuit, and that will cause a seizure. Calcium and magnesium. But are people ever told that you probably need magnesium? No. You probably need, they wait until we're far older and say, hey, you need calcium, and even then, they give you the wrong kind of calcium. Your body only absorbs a certain type. The type that you're going to get from the doctor typically is not absorbable, but it's still calcium. That's the thing, okay? Let's talk about diabetes. Now, typically, the causes of diabetes, genetic, lifestyle, obesity, autoimmune factors, type 1, type 2, things like that. Well, based on autopsies, type 2 diabetes, which is the most common, people develop it later in life, which will make a lot of sense for you. When they checked the autopsies for people who had passed away who had type 2 diabetes, they were hugely deficient in 2 vital minerals. Not vitamins, vital minerals. Chromium and vanadium. Anybody ever heard of those? I'm sure y'all do that. Chromium, okay, good. So chromium is going to be in most weight loss supplements that actually work. And the reason it works is because chromium, in its raw state in nature, that mineral is very sweet to the taste. It's very sweet. So people who are always craving sugary foods, it's not that they want the sugar. Their body is telling them, you are missing chromium. It's the sweetest mineral. It tastes like fruit almost. It's so sweet. Like liquid sugar. But it tastes like, it's not sugar, but it tastes like that. So they're trying to get the chromium, but they don't know that that's why they crave sweets. And that's going to cause the insulin spikes and then the diabetes because you become insulin resistant. You're just chromium and vanadium deficient. They work together.
I know. I'm like writing and getting excited.
Okay,
And I got it.
They're hidden. Oh, they're behind the bag. I couldn't even find. Okay.
We do this once a day, don't worry.
Oh, okay.
Like,
Good. No
Sometimes
worries.
twice. Sometimes twice.
So that is how that part works. So you can prevent, according to actual science, type 2 diabetes by making sure that you supplement with chromium and vanadium, and we'll talk about why it's not in a lot of foods too. We'll talk about that as well, okay? Now those trace minerals, chromium and vanadium, are also essential cofactors for insulin. Without those two, where they work together, sugar cannot be transported properly into a cell. Doctors won't tell you that because most doctors don't know. They go to school for 8 to 12 years, but they only get maybe a 1-hour class on nutrition. Everything else is surgery, drugs. This is wrong, prescribe this. This is wrong, surgery that. This is wrong, give them this drug. Because that's where the money's at. There's no money in not getting sick.
In wellness, yeah.
Yeah, there's no money in wellness. Yeah, you know that. Okay? And this is what one doctor said. Dr. Joe Wallach said this. He said, and I didn't say this. This is what a medical professional said. Every case of adult onset diabetes, which is type 2, is a deficiency of chromium and vanadium. All of them. That's what he said. Let's see. Okay, how many people remember Hank Gathers or Reggie Lewis? They were very popular basketball stars. Reggie Lewis played for the Boston Celtics. Hank Gathers played for Loyola Marymount. But Reggie Lewis is an interesting story because in the 90s, he signed a contract for $65 million with the Celtics. Like Larry Bird and Kevin McHale and Robert Parrish were on the way out, Reggie Lewis was the guy they were going to build the team around. In the early 90s, Reggie Lewis has a cardiomyopathy heart attack at practice. Falls out, doesn't die, but has a heart attack. Like, man, that's crazy. because he's such in great shape. He's incredible. Incredible. I remember this guy. He's incredible. I had his basketball card. Incredible athlete. So what they did, this is the Celtics too. It's like Celtics Lakers. I mean, come on. They got the 12 top heart doctors in the world. They told them, cancel all your patients. We're going to pay each of you $1 million a year. It was the dream team of heart doctors. Boston Celtics got money. So those doctors were like, yep, our patients, I'm going to just refer you to somebody else. I'm making $140,000 at the hospital, but that's not $1 million for one patient. We're going to Boston. So he has the top 12 heart doctors in the world to figure it out, work with him, get his heart straight, because the Celtics do not want to lose $65 million.
No.
You're going to pay this man, you're going to pay his widow. Somebody getting paid. The Celtics want a basketball player. A couple months later, he has another cardiomyopathy heart attack. While under the cares of the doctor, by the way, passes away. Reggie Lewis, no longer with us, 1993. Checks out, goes to the upper room. That's not the oddest part of the story. The number one doctor on the dream team of heart doctors died 6 months after that from a cardiomyopathy heart attack. These are the top heart doctors in the world. So what are we going to do? We are going to talk to dead people, because dead people don't lie. Dead man tells no tales. So we have to go look at the research of autopsies. What do all of these people that are having that specific type of heart attack, which is the most common, cardiomyopathy heart attack, what do they have in common? I wonder. If diabetics all had, type 2 diabetics, most common type, all have a certain mineral deficiency, if the epileptics, the most common type, idiopathic epilepsy, all have a certain type of deficiency, calcium and magnesium, is it possibly beyond the realm of speculation that the people who suffer from the most common type of heart attack all have the same deficiency? Maybe. Mm-hmm. It seems to be what the evidence would indicate. And here it is. Here it is. Thousands of autopsies on cardiomyopathy heart attacks revealed the severe deficiency in one thing, a vital mineral called selenium. Most people have never heard of selenium, but selenium is the number one thing by far that you can take to put yourself out of the heart attack risk category. It's not exercise. Exercise actually makes you more likely to have a heart attack, and I will tell you why. Because joggers will just fall out. Everybody's seen that in the paper. People running and so-and-so died during the basketball game. Sometimes high school kids, they'll fall out in a football game. LeBron James' son fell out, heart issue, middle of practice, right?
Yeah.
This happens regularly, okay? But we're going to talk about why. I'm not going to leave you hanging today, okay? So if you want to prevent cardiomyopathy heart attack, the number one thing you can do, supplement with selenium, okay? All right. Now, this is why you can't find a 100-year-old football player. They don't exist. If you want to find people that are really older, like into the hundreds, they are not working out. They may walk or have a dog or a cat but they just relax. They drink tea, right? They're not super athletes.
I'm gonna live to be 100.
Yeah, if not beyond. I read an article from the University of Washington that said, based on current information that's coming out and current supplementation, anyone who's alive today, with no exception regardless of age, can live to be 140 years old.
140?
In good health. Some people might not want to live that long.
Oh my God.
But they could.
If I feel like this now,
Oh yeah.
But they could.
can't imagine I feel like
But
140.
you'll learn how today, should you so choose.
Yes.
Okay?
Yes.
Now this is the thing. This is why you don't have 100-year-old soccer players or boxers, offensive linemen. They typically die in their 60s for just whatever, right?
Yeah, we can say that like all the football players, they die young.
Young, yes ma'am. And this is why they die young. It's not the tackles like people think. It is going to be because football players sweat the most. They practice outdoor in high school. They're sweating their whole lives, all the pads, uniform in the summer. They sweat the whole time. When you sweat, you're not just losing water and salt. You're losing magnesium, calcium, selenium, vanadium, lithium. You losing everything when you sweat. And for young ladies, when they have that time when they become a young lady, that's not just blood. They're losing so many minerals and nutrients. This is why when girls are really, really young, 3, 4, 5 in kindergarten, first grade, they're always taller than the boys.
Yeah.
Girls are always bigger young. But when they become a young lady and that process starts, they slow down in growth, and that's when boys pass them up. If not for the menstrual cycle, women will be larger, taller, and stronger than men. You just lose too much for too long. Your body needs those minerals and nutrients, and if we don't put them back into the kids, they're all gonna be like that. That's why the young athletes and the boys in particular, they sweat so much. Every mineral we just named, plus another 80, they're losing in sweat, urine, blood. Anytime you get cut, you ever have a surgery, you're losing so much of that. If you don't put that stuff back in, you're taking years off your life and you don't know it. Because when your body runs out of that stuff, bad stuff happens. You gotta put it back in, okay? Now, I'm gonna give you a couple of really common deficiencies, and then I'm gonna just, because y'all understand the premise, right?
Absolutely, yeah.
Mineral deficiency, bad stuff happens.
Yeah.
So now I'm gonna give you some common issues and how to fix them or prevent them. Arthritis. Arthritis is gonna be caused by a calcium deficiency, period. But you have to supplement it with the right type of calcium, okay? And that's gonna cause, now when you don't have enough calcium, and sometimes you get bone spurs and you get other types of bad things and joint pain. People would think, well, I'm getting bone spurs, that's extra calcium. Yes, that is, you're getting that because your body doesn't have it. It's not that it has too much, it's that it doesn't have enough. So it's trying to send calcium and it's just not making it to where it needs to go. So it just stops in one place because of circulatory issues, which is also going to be a deficiency, and you get those spurs, okay? But it's a calcium deficiency. And also magnesium deficiency. Magnesium deficiency is going to make the calcium imbalance work worse. Remember with epileptics, calcium and magnesium work together. In fact, there's some type of vitamins on Amazon that are called CalMag because they go together. Yep. Okay, let's talk about another one that helps with that causes arthritis.
Excuse me.
Yes.
When you go to the doctor and you tell them all that,
Yes.
do they help you with that?
Sometimes yes, sometimes no. Depends on the doctor. Yes, ma'am.
Yeah.
If it's an open-minded doctor, they will say, you know what, I'm glad you're looking into this. I will look into this too. Other doctors, if they're a little more set in their ways, like, don't listen, that's hogwash, don't listen to that. It just depends on the
Just
doctor.
like a chiropractor.
Just like
A lot of doctors were like,
And
but
I
after you go to the chiropractor, you're like,
chiropractor.
oh my God, thank you.
the best.
Or he does like dry needling. He had like something in your shoulder and like 2 times. And I've been talking to my doctor for weeks about it. And I went 2 times. And then now I'm like, oh my God. And he gave me some stretches.
There it is.
And so it's like you have to find your own path.
You gotta shop around.
Find your own path.
Yeah, you don't end up with the first person you date a lot of times. You gotta move around a little bit. Sometimes you gotta move on to the doctor a little bit. We'll figure it out, right?
Yeah.
But that's what happened with me. I had really bad sciatic nerve pain. Super bad. My doctor says, we can do a surgery. You can just, snip that nerve. You'll be fine. But he'd be right. It's going to cause a whole bunch of other problems. But one of my buddies who's a big-time bodybuilder in outside of Baton Rouge, he's in Denham Springs, Watson, that area.
Yeah.
He was like, no. Go to the chiropractor. If that doesn't fix it, go back and talk to your doctor. You know it. You already know how the story goes.
Yes.
I
will go every time. Yep.
No, I had that. I had the part. I was on the table where they like pull you.
Oh, doesn't it feel good? I love it.
Dude, I was in pain. Like
you hurt?
excruciating pain.
Oh, the chiropractor?
No. Like
They help. It helped.
I went.
We continue to go. We continue to
this
go.
is like 15 years ago.
Oh,
Yeah. I'm gonna get better. It'll go away. It's gonna go away.
No.
I'm talking about like take your breath away pain every time. I was fine when I was sitting, but as soon as I stood up, I was like,
ooh.
And I finally went to a chiropractor.
There you go.
And he put me on that table.
Yeah,
And,
traction.
you can't see it, but it's like
feel it.
It's
they do
sometimes
this,
the
and they do
tingling,
this,
tingling,
and they're like,
all
okay,
that.
3 times a week for like 4 weeks.
I love that.
I mean, in 2 weeks, I was like
Already,
80%
You
better.
can feel such a big difference.
Oh my God! I was like, I don't know if I didn't go. I don't even know what would have happened. Like
You would have had
I
surgery.
would have had
after
surgery too. I would have had surgery too. Same thing. I would have had surgery.
I mean, they call them quacks, but I'm like, hey man, it
They
worked.
are not the quack. They work.
It does.
But
does.
so much of that, and then you look at like the political climate of the world too. We're learning that so much on either side of the fence just wasn't true. Now we're just learning a lot in this last 4, 5, 10 years or whatever. Like, did y'all lie to me about something else maybe?
We even heard that this is off the track, but like our chiropractor can actually help people that have severe headaches. It's something is misaligned. They can align. They can.
Well, everything's
connected.
in your body
you know,
is connected to
It's
your
connected.
mouth
Ooh.
and your back.
That I didn't. I knew the back. I didn't know the mouth. I
Yep,
didn't
you
know
got
that.
bad teeth.
Yeah.
And like not good. Not that you have bad teeth.
Gums,
Like
but
Yeah.
And you have
It's a
disease,
sign of
gums, and
something
everything.
else.
Yes, something else.
I did
Yep.
not know that.
Yep. Your
See?
back, your
I learned
spine.
something today.
Your
I knew the
spine
back, I
and your
didn't know the
mouth.
mouth. But you're right. And so to wrap up on the arthritis part, boron, sulfur, and copper. I won't go into details, but those things, calcium, magnesium, boron, sulfur, and copper, if you're deficient in those, you're setting yourself up for raging arthritis. And that'll happen to almost anybody when they get a certain age, not because they're older.
Right. My mom's having it really a lot of pain in her hands now.
Yep.
Fingers and hands.
You
And
tell
so
her that,
I will put that.
Yes, yes.
Definitely pass
If it
this
does
on.
not give her some relief within 2 to 3 weeks, tell me how much it costs to get it. I will pay for it. That's a common thing. My mother had arthritis as well.
Like finger,
She
hands,
was
and
incredible now. Yeah, that's where it starts. A
So
lot of
what's
times.
that one?
Arthritis?
No.
to help us with essential oils.
Yeah,
It's gonna
what's
help
that
us with
one?
that.
Oh,
one.
okay. Yep, we're gonna. In fact, those are not gonna be. That's gonna be the powders.
Oh,
That's gonna
okay.
be- yep.
Oh yeah,
We're
she
on
will
the powders?
try.
We
She
are
will
on the
try
way. Don't worry. We
bunch
are
of
on the
stuff.
way.
Good.
Yep. I got you. Yep. I got you. I got you covered.
Good. I would definitely want to know.
Now, let's talk about, very quickly, brain cancer. I'm only going to talk about brain cancer. It's very rare, but when they do autopsies on people with brain cancer, they are always deficient in a vital mineral called gallium. Gallium. We don't know what else it does, but if you don't have it, you may get brain cancer. Gallium is what it is. Parkinson's disease, okay? People who have Parkinson's, when they studied the autopsies of people who had Parkinson's, they were deficient in selenium. That sounded familiar. Copper, that's familiar. Manganese, that's a new one. And zinc. Those are needed to protect brain cells from oxidative stress. Okay, to protect brain cells, very important. Also with Parkinson's, lack of essential fatty acids. Omega 3, 6, you hear those buzzwords a lot now. Omega 3, 6, and 9 fatty acids, fish oil, stuff like that. You hear those a lot. Okay, we have those in the products as well. It's actually in that bottle right there. But because the brain, actually, a big part of the brain is actually made out of fat.
Yes.
So when people do not consume enough fat over time, the brain does not have enough raw material to sustain its weight and size. So it'll start to shrink.
Edie, we don't have that problem. We get enough fat.
See, it's important. You should.
Brisket.
Oh, I love it. Good. Keep it up.
I'm not shy of fat.
Fatty fish, brisket, stuff like that. So when people go on a super low fat diets and stuff like that, you gotta really watch that, especially long term. Your body needs that.
One guy I had listened to talk. He said one thing he does is he eats a lot of eggs and he eats all the yolks because he needs that for his brain. And then of course it's coast to coast, and they go into all this. It's a talk show, but it's early, and it's like he was talking about how the yolk is actually part of a good cholesterol, and we need
good cholesterol. 100%.
He eats all the yolk
If you don't have it, it's a
eggs
bad.
and the yolk and
100%.
brain function.
I'm a huge function of eating the whole egg. I'm a huge fan of eating the whole egg. Also, two more things that can really make Parkinson's rough is going to be low glutathione support. And those minerals we listed, if you don't have those, your body's not going to produce glutathione, and you need that. And last but not least is actually going to be gut health. Because you can be taking the supplements that we talk about, and I'm taking my copper, I'm getting all the stuff's in there. I'll tell you what has what in a second. But all of that's in there. But if you have compromised gut health, your body can't absorb it. This is why probiotics are very important. Probiotics and prebiotics have to repair that intestinal tract because gluten will damage it. McDonald's will damage it. Fried foods. Yes, ma'am?
Is copper a vitamin?
Yes. Copper is. It's a mineral. That's
I remember my father always wearing copper things.
Yeah, copper is very good for your body. The copper bracelets, you'd be shocked at how many amazing things. Magnets and copper. If you see somebody wearing magnets or copper, they know their stuff. It'll probably help them with balance and things like that as well. Smart man, you dad. Okay, now speaking of copper, we'll talk about this. Let's talk about aneurysms. Oh, okay, you got it? Yep.
Okay, it's just another call. It's okay. It'll go over.
No worries. Okay, so aneurysms, and an aneurysm is going to be a blood vessel that gets weak and eventually breaks. Okay? If you have an aneurysm in a blood vessel that's in the brain, that is called a stroke.
Yeah.
Okay?
My father had something like that.
Okay.
But you know what they told him?
Yes.
Me and my mother left the hospital. We went to San Francisco to pray. My father had 2 hours
2 hours?
So I was living at a temperature of 105, and they said he's not gonna make it. So we went somewhere to pray. Then we came back and the doctor said, I don't know what happened. But he's better.
Wow.
They probably gave him a solution of.
He couldn't eat, he couldn't walk, and he was, he had a high temperature.
But he recovered from the stroke.
He did.
Okay, there.
But he still had whatever he had in his head.
Oh,
They
yeah,
said-
sure.
They said they couldn't afterwards because
It's your brain. Yeah, that's sensitive. They gotta crack your
Man,
skull.
that's
for
a
that.
long time ago too.
I'll take,
Yeah, oh, yeah,
Now they
yeah.
got much more non-invasive
If
surgery.
they got an open head, it's hard. It's scary anyway. You know,
It's completely.
yeah,
Oh
it's
my
scary.
God.
anyway.
Yeah.
But we'll talk about those. So aneurysms are going to be caused from a copper deficiency, which is what she brought up. But you need to consume it. Okay. Now, why does it work that way? Copper, if I had to break it down, is like the glue and stitching that keeps blood vessels together.
but
So-
they didn't talk too much about things like that.
Oh, they didn't know back then.
No.
They didn't.
It
They
takes
had
a
no
lot of
idea. They didn't know.
science and repeated
Oh,
science.
yeah, this is all
Repeated.
literally cutting edge, recent
Repeated
last
science,
20
yeah.
years. This is
Yeah.
2000 and up.
Yeah.
Yeah.
And multiple people have to say the same thing, the multiple findings.
For years.
Years. And
the
then
whole-
they believe it.
And then all of the doctors have to age out, and the new doctors
Still have to prove it.
and then they'll be the ones that even entertain it.
Yeah.
That's how it happens. That's
Yeah.
how it happens. So, but that's why we have to do our research so we can be proactive. So, copper is the glue and the stitching that holds the blood vessels together, and it helps your body weave collagen and elastic fibers into strong, stretchy walls for blood vessels. You will know if you have a copper deficiency because you will have either varicose veins or spider veins in the lower leg. If you have varicose veins or spider veins in the lower leg, that is a sign, and it is only a matter of time before you start to have those broken, crinkled vessels in the brain. That is a stroke. Okay? Stroke. So you want copper.
Okay,
Yes.
so what if you have them in the upper legs?
You can have in upper legs too. That means they're working their way up.
Okay,
You can't
so
see
yeah.
them all.
No, and I think some of that might be genetic too, but like,
We'll talk
and
about that. Yeah.
working and sports and
Oh no, it
And
all
physical.
goes together. It's
Yeah,
not
so-
anything that we're doing
I
wrong.
just got this one right
It
here.
is
But
that I
just a
had
part
for like
of
10
living
years.
life.
I have. Then I definitely have. I need
We'll
copper.
talk about
this
why
one.
it wasn't always that way in a minute too.
Okay,
So
copper
with
for
enough
sure.
copper, the blood vessels are going to
Everything
be
else I got
tough
is in
and
area.
flexible. Okay, so they'll be good there. Without copper, blood vessels get weak and brittle, like a old rubber hose. When too much water go through it, it's just what it is. Okay, but it's not because we're doing anything wrong. It is because the food that we eat today, and y'all know this, the food we eat today, it doesn't have the same nutrition when this young lady was growing up, and the food she ate doesn't have the same
My mother
nutrition.
loved it
before.
when they came out with the processed foods.
What's that again?
My mom loved it when they came out with the processed foods.
Oh, really?
Yeah.
Because it's easier.
It
They
is,
easy. She
it
didn't have
is,
to, yeah, she
it
didn't have to
is.
work hard. Yeah,
I
that's
thought
the
it was
difference.
the greatest thing.
It was for convenience and time and freedom. Yeah, I mean, but yeah, no, it's true. It's true. So copper deficiencies can lead to aneurysms, bleeding problems, slower healing, and of course the spider veins and the varicose veins. Those are just warning signs. You have time, but that's typically when you start to see it. And notice they always come later in life, a lot of times with active people, because we sweat, you work, you have surgeries over time. It's different things, right? Now, copper doesn't show up on most food nutrition panels. So even on these, I'm going to tell you how much copper is in them. But even on the back, you won't see, what's in copper? No, copper is not a mandatory nutrient by law. So a lot of times when you look at different foods and things, you'll see calcium, you'll see protein, you'll see fat, you'll see carbs, because they're required by law to be on there. If all of the stuff that's in these products and other products was on the back, the label would be this long. And they'd have to jack the price up because of ink, right? So we'll tell you everything that's in there.
Well, they're
So,
only required to tell you, and like just recently, right? Like the last 10 years, they started telling you more on the cans, like can of
yes.
soup, just other stuff in the grocery store.
other stuff in
But
there, yeah.
that was
for a
like
long
government was like, no, you need to tell us this, and this.
Yes, that's the only
Yeah.
reason why they do it, because
Yep.
otherwise you wouldn't need half that stuff, to be quite frank.
Nope.
And yeah, and so the only time you're going to see stuff like selenium or copper on a label is if it's either required by law, which it's not yet, or if the manufacturer makes a claim about it, like this is a copper supplement or has 100% more copper, you have to say it. So this in here, they just don't have it on the label because they're not required to. But I'll tell you about it, okay? So to make a long story short, these particular products that we have are going to have everything we talked about plus some. But that's not the full list of what the body actually needs. For example, there are 90 vitamins, minerals, and nutrients, and fats, amino acids, 90, that the human body needs to function at its optimal level, 90. Now, most people are born with all 90. If their parent had all 90, if the parent was not born with all 90 because they were missing one, either because their diet or nutrition, that is when the bad things are going to happen. For example, if a mother is severely deficient in calcium and doesn't know it, the child can set themselves up for rickets, cleft palate, or skeletal malformations because of lack of calcium in the mom, okay? If
No,
there's
it
a
was my
zinc
dad.
deficiency, say again?
No, I was just saying.
Oh,
She has a cleft palate.
It was my dad because my dad's brother has one. So
Really? Okay. So, but did everybody grow up? If people grew up in the same area or in the same region or ate the same foods or things
No.
like that, it
Well,
could be
they
anything.
told me that because I lived near the airport. That's what they told me.
Near the airport, it's gonna be, could be. But if you think about it though, it's gonna be calcium because the bones needed to form and close out. They just ran out of raw material, and that's one of the last things to cover.
it's okay, Mom. It's Dad.
Yeah,
It's-
yeah.
yeah.
We'll blame Dad. No, we'll blame Dad. No worries. No worries. All right.
His grandpa Otto.
Okay, it's zinc deficiencies can cause the same, but zinc deficiencies is even more devastating. They can cause spina bifida or limb malformations if there's not enough zinc for the baby to create a full healthy baby. Okay, copper deficiency, when the baby's born with a congenital heart defect, vascular malformations, it's because the baby's mother or that mother's, like it got passed down somehow, or they were eating properly. Then you know our food's all changed the last
Yeah.
year. That's not that apple today is not the same as it was. Doesn't have the same nutrition in it. If there's a deficiency there, the baby can be born with those type of heart defects. Selenium, very similarly. Chromium deficiency. If they were to take a baby and say, "Wow, this baby doesn't have type 2 diabetes. They were born with diabetes, type 1. They're born with it," they could check chromium deficiency. Okay, immediately they would know that. Manganese deficiencies, iron deficiencies can cause brain development defects, cognitive impairment, and microcephaly. Okay, so we could go through the full list. We won't, but just understand, people need to have literally all 90 of these vitamins, minerals, and nutrients to be a complete human being. If not, you may not notice it at first. It might be just something small. You know, it's a little pain here and there, restless leg syndrome, could be anything. But it typically comes back to a deficiency in something.
Restless legs.
Yeah, could be anything, right? Now, the United States ranks #1 in most expensive healthcare. I think that's pretty commonly accepted. But we don't even rank in the top 30 countries in the world for healthiest people, for wellness, for infant mortality, or life expectancy. So we pay more and have the high-techiest, most pharmaceuticals, most expensive healthcare in the world, by far. No one else is even close. But our babies are not even in the top 30, and our older folks are not even in the top 30 countries of how long we live or how a baby might survive. Now, why is that? Because the system kills 250,000 people a year. Let's not forget that, right? So people will typically say, okay, we got 90 nutrients. I've heard people tell me this. I can get all 90 of my minerals and nutrients from food. I don't need supplements. I just eat really good. I eat organic. I eat clean. Okay, and then I have to tell them this. The United States Senate report, Senate document 264, from the 74th Congress, second session, says the following. It explicitly warned about depletion of mineral content in American soil. Okay? The report concluded that many heart problems, heart disease, arthritis, deformities, and dental issues are linked to crops that are grown in mineral deficient soils, regardless of how much of it you ate. Doesn't matter.
They just had that on television, a special, and they showed how it's the ground, the soil.
Yes, exactly.
They have to fix Oil.
They never give it a break.
Right.
Yeah.
They don't put the nutrients back in, and you're supposed to let soil rest every 7 years.
Like switch
Switch it and then
switch,
let it
yeah.
7 let it
Yeah.
breathe. It has to replenish itself. They don't allow, even when people rake leaves, supposed to let those leaves decompose and go back into the ground, right? And it makes.
And you made me rake all those leaves.
Oh no! If you're gonna rake them, mulch them and put them back down. If you just don't want to look at them, rake them. And yeah, okay.
They're there for a reason.
Yeah, they're for real.
Yeah,
But here's the
that's
point. The soil doesn't have what it used to have, and the U.S. Senate knew this. They spent all that money to do these studies years ago, and so they know, okay? So in other words, the soil became so depleted that the foods that were produced, it'll still produce food, but the food will not have the minerals and nutrients that we need to exist healthy. It says this: the foods produced are so depleted because of the soil that they can no longer supply essential nutrients to humans or animals. Just can't do it. Okay? And this is all from the Senate report. This is not my words. It's all from the Senate report, word for word. 99% of American people are deficient in minerals, and a marked deficiency in any one of the minerals actually results in disease. Foods, fruits, vegetables, and grains are now being produced on millions of acres of United States land that no longer contain enough of certain minerals. It is starving us no matter how much of them we eat. And that's from Dr. Charles Northern, who wrote that report. And now for the record, that report was buried. Mm-hmm. You want to find U.S. Senate document 264, you can find it on Google now, but most people have never heard of it. But it is the government literally saying, this is what you need to do, this won't work, this is what you need to do. And I'll finish this part with this. It says, one sure way to end the American people's susceptibility to infection, and it means disease, but disease and infection, is to supply through food a balanced ration of iron, copper, and other metals and minerals. An organism that is supplied with a diet adequate to, or preferably in excess of, the more the merrier, in excess of all mineral requirements, those 90 minerals we talked about, may so utilize these elements as to produce immunity from infection quite beyond anything we are able to produce artificially by our present method of immunization. You cannot make up the deficiency by using prescription drugs. They call it potent medicine. You can't make up the deficiency. You can't treat your way with prescription drugs a nutritional deficiency. You can mask the symptoms.
Right.
You can mask the pain. The pain is still there. You just don't feel it. Right. Your body's giving you a signal, something's missing. You kind of want to get that, right? So that's how that works. So out of these particular 90 essential minerals, nutrients, vitamins, and amino acids, all of those are covered by a combination of things on this table. So we'll talk about those. Number one, super important. Listen, do y'all have this one?
Not yet. We don't have any of the.
Okay, no,
we just
I'm
have the paint.
Lillian bring one is what I meant.
Yeah. Oh, yes.
Oh, there
yes,
it
yes.
is. Of course she has.
Okay.
Okay. So this particular one is called Ocean Vitality. Okay. This tiny bag, the scoop is that big. This has over 100 servings. This will last you 2 to 3 months easily. For like $50. It's amazing. But this particular one, when you add it to this, which is fulvic acid, it's like 20 some bucks. If you were to take a cup of water or a shot glass, orange juice, apple juice, or a cup of water, orange juice works really good. But water, you put 1 dropper of that and 1 tiny scoop of that, just shake it up and take it like a shot, you automatically have 60 of the 90 already. That's how potent those are. You don't need a big scoop, tiny scoop, because you don't need a lot of gallium, but you need some. You don't need a lot of lithium or silver, but you need some. Why? Because some of those micro minerals and things like that, very, very small amounts. Your body doesn't need a boatload of it. If it's pure and in its proper form, you can get a little bit. Does that make sense?
Yes.
Okay. So you got 60
What's
out of the
this
gate
again?
with those.
This is
Folic
the.
acid.
Okay, I thought he said folic. Okay, just write it down.
If you want to cover the other 30, the ones you would need, which is going to be Beetroot Max, has a ton of stuff in there. You get your copper. Yeah, beets are so good. You'd have to find not just organic. Yeah, it's going to be. You'd have to get beets from out of the country to be nutritious properly. But yeah, the beets definitely work. That has a ton of stuff in there, but not just beets. The copper supplementation's in there as well. So you got those three. This one is going to have those omega-3s, 6s, and 9s, and some other things for your brain that we talked about, for Parkinson's and stuff like that.
It's called Mind.
Yep, Mind. Yep.
And you mix these two with orange juice and stuff like that.
I put them. I'm gonna say what I do.
Okay,
I put them
please.
all together in water, and like either the Crystal Light or the little sticks.
Yeah.
Right. I'll put like a half of one in there. It's like sugary, but it makes it way more delicious to drink, and they all mix together. Or you can just be hardcore and you can just drink it straight. You can drink it neat. It don't taste good, but it works. And I talked to our product formulator, Dr. Alexandria Brighton, who put this stuff together and formulates all of our products. She was like, yeah, as long as you're being consistent taking it, that little bit of Crystal Light won't kill you. I was like, good, because I was worried.
Yes,
and I just want to be
consistent.
I just want to be consistent.
Good.
And the last one that is an absolute must, all the rest are optional. It's going to be this combination right there. The Gluco Protect with 21 vitamins and minerals, the Mind, Beetroot Max, Ocean Vitality. When you combine those, we should probably get those in a bundle. I'm going to email on Monday and get them in a bundle. But those are going to have all 90 of what you need. Everything we covered is all included in there, all guaranteed to work, all properly formulated, all natural, all organic. And the stuff that it's made from, because our facility is FDA approved, most places is not, because the FDA is not required to license supplements. So they don't have to come tell us anything. But our company, Green Organics, they paid to get licensed by the FDA. And what that means is the FDA can come at any time and do a surprise inspection. They can shut you down. And most supplement companies will not even do that because they don't want that level of scrutiny. And I can respect that. They don't want to spend those $250,000 to get that to happen, and they don't want to get shut down. Our company was all about it because they're paid very well, they're good, they're debt free, but they wanted the highest level of possible scrutiny. So when FDA came in for a surprise inspection, I think it might have been 2 months ago, they go through every product, over 200 products. We just have a sampling here with the ingredients, and they went through everything. They said if this doesn't have copper in it, that the right type, this, that, and third, y'all shut down. They found no issues. Everything that we had was, and that's why we talk about this stuff so confidently, because we know what it does for us, but it's really great when the third party, like the FDA, it doesn't even like us, by the way. That's the Food and Drug Administration. They want food and drugs. And the last thing that I would mention, I didn't see it on the table. This is an optional one, not necessary at all. This is called Gut Check, but this is going to have those probiotics in there. This is going to have some fulvic powder for absorption, inulin, matcha, which is real popular right now. This is only when people take that, they're like, man, it's been 2-3 weeks, I'm just not feeling. You may have a gut issue that's preventing you from absorbing this stuff. So let's go ahead and fix that. Let's fix your gut, and then you'll be good to go. And that normally does the trick. But it's not absolutely necessary at all. That one, it really is about that core. And a lot of times people are able to, this one will last for over a month. This one will last for 2 or 3 months, even that small bag. This is a smaller bag, but it comes in a larger bag. You'll be able to kind of taper off and start to monitor your dose when you see issues that you had that are start to go in the way. Like, okay, I think I'm good. I think I'm regular where I'm at. If I start working out really, really hard, I might need to start supplementing again. But you just can't get it from food anywhere. And that's what U.S. Senate report was talking about. So that is basically what we got, okay? As far as products, health issues, mineral deficiency, and things of that nature. If y'all have any questions about products, other ailments, or anything like that, by all means, let me know. And there is, yes ma'am, I love questions.
No, go ahead.
Oh, no. Any other questions about the products? I will answer those.
So what about kidney stones? What kind of products would you have?
I would have to look that up.
That's like a family.
That one?
A family thing that's kidney
Yeah,
stones.
our
Not
yeah.
me.
Okay,
Like us.
niece-in-law, but like she's our nephew's wife. She's
Like,
had
seriously, she's already
surgeries,
had, like,
three
she's got, and her brother had the same.
3 surgeries.
You know, and
Okay.
she's cut back on. You know, she's a terrible eater. She's like, she eats like a 6-year-old,
Let me
right?
shoot.
Like
I'm gonna shoot Alexandria a text.
Sonic, all that
so you
stuff.
saying soul?
Really? I don't think. Listen, this is a healthcare professional.
I had kidney stones
Oh, there we
for
go.
years.
Oh, yeah, I've never had.
So I listened to Alexandra.
I was just about to
talking
text her.
about one
Okay,
of
that's what
these,
she's gonna tell me anyway. Okay.
And she was telling me this. She was saying that this would actually break a stone.
Ooh.
Really?
Yeah,
We're
'cause
gonna
I
get that
already
for her
back
today. We can actually.
So,
I
Will
need to
she
go
take
for
it? I don't know, but we're gonna.
you remember that talk?
No,
Mhm.
you're-
Yes.
she might take it because it's
I learned
amazing
something
what
new
people
today.
will do when they're in pain.
Oh,
She
no,
has
she's
had
on
so
pain.
much
Yeah.
pain.
Wow.
We'll get this for. We'll get. Yeah.
I'm going.
I've had kidney stones since I
Oh,
was
no,
17
we
years
don't
old.
want that.
Oh my God. Okay, so look.
I'm glad you said so.
Let me
I've
put
never
this
had
here.
kidney stones. I don't know.
And I have
Lillian
more-
did, and she doesn't have any more.
I have
So
more kidney stones.
I will go with her recommendation. What I'm gonna do, Lillian, too. I'm gonna send a message. I'm gonna put a reminder to ask Alexandria. Not just. I know she's gonna recommend that to get rid of kidney stones. I want to know what causes them. Is it a deficiency
Pat,
or what?
do you have any?
And when
You
I
got any
find out,
questions,
I will.
Pat?
Magnesium and
I did,
calcium.
I sent you a text.
Magnesium,
Oh.
it's a lack of magnesium.
Really?
Because it doesn't send the calcium.
Oh yeah,
to
I
the
told them
bones.
about
gets
that.
stuck.
About you.
It gets
And it
stuck
starts
in your
piling
kidney.
Yeah.
Exactly.
Well, there we go. Kidney stones. Okay.
That's
Look,
right.
look,
That's
I learned something from you today. I love it.
Okay, so Pat wants to know about fibromyalgia.
Okay, so
Myalgia.
fibromyalgia. Let me send a text to our formulator for that. Give me 1 second, Pat, and hopefully she will get back to me while I'm still here. What causes fibromyalgia and product recommendations? Yeah, anytime I don't know the answer to the question, I will go right to the professionals and I will ask them. I do know it's very painful.
So what's all these little things? These are like,
Oh, we'll talk about those in a second. Yeah,
Oh, okay.
yeah, we sure will.
cause you know I got my chapstick in my pocket.
I know. I love it. Oh my goodness.
I don't go anywhere without my chapstick. My friend, this is like homemade stuff. My friend.
Oh,
makes it.
chapstick. You gotta have chapstick. Yeah,
Yeah.
in Louisiana, we gotta have chapstick. I love it.
Fibromyalgia. Do you know anybody who uses this?
Yes.
Slimmer Max?
Oh, yeah, yeah. And so the reason that works is that the most potent ingredient in it is Chrominex, which is a souped up form of chromium, which is why it works for cravings and things like that.
Okay,
And that's
so
why
I'm gonna
people
try
lose-
that. And you
people
would
lose
put that
weight
in
on
your, with your crystallite
Well,
too.
oh yeah,
Also, you'd be
it's
like-
so funny. All of these products, let's say for example, you took all of them except for these two, because these are teas.
Okay.
So you gotta brew these.
Mm-hmm.
This is tea, this is tea, this is tea. But other than that, if you took a scoop of all of these and put them in a big glass of water, and you put like Mio or Crystal Light or something in there, they would taste great.
Okay,
You
I
don't
can
even-
do it. I can do
It's
it.
the weirdest thing, the way they formulated these products
Okay.
to work synergistically with each other. It's incredible. I do it every day. Yeah, I don't drink 9 different things. It's just one thing.
Protein shake.
You want to taste it? Yeah, you want to taste it? Yeah.
Put it in a protein shake and
My sister said that she needs everything.
Look, she,
Yes,
she has
it's
got
true.
she's
I'm
got
already
the-
gonna- I'm up to
My
7.
sister and I are tea drinkers, so.
Yeah.
Oh,
Can even get her like
Yeah,
one of the
yeah,
teas.
we're at our house, but I was saying like, oh, I want to do this again because I just thought like, my friend's mom was gonna come over and talk to us about like the product and stuff, so I didn't really have like a party. And like a couple days ago, she was like, okay, well, anybody else coming? I was like, oh shit, we're having a party? I didn't know it was a party. I should invite people. Like, I just thought it was like, she's gonna come and talk to us about some stuff. Cause mom was here and I wanted mom to like, hear the spiel and everything, right? So next time I said, oh, my sister's coming for Mardi Gras. Of course, it's a long time away, but not really. It goes fast.
Here is,
But I'm
she
like,
just
yeah.
messaged me back.
Next time.
Fibromyalgia.
here
Well,
we
I
go.
don't want to cut you off. I just want to say it before while I got it. Fibromyalgia deficiencies are magnesium, calcium, potassium.
Oh, there you go.
And then if you are lacking those, you're probably lacking enough of the other 87 to really matter. Those are the main 3: magnesium, calcium, and potassium. Because it's going to be.
Don't believe in fibromyalgia.
What she said?
Some doctors don't believe in it.
Oh no,
Oh,
I know
right.
people
Bullshit.
personally
That's
who
a real-
suffer
oh,
from
that's-
extreme pain, and the reason why the calcium and magnesium works, if you think about it, we talked about epilepsy, right? With the
Yes.
nerve signals to and from the brain and the full circuiting. So it makes sense that fibromyalgia would be an advanced form of that from a pain standpoint, because it's literally the pain receptors are flaring and going crazy, but it's the brain that creates that, the pain signal from the brain. So it's going to be but it sends it to different parts of the body. One of my friends who's she's fine now, but she started out with our products. She would have it all over. Plus she had not just fibromyalgia, but some type of neuropathy, some neuropathy nerve pain added to that. She's fine now, but that's what it is: calcium, magnesium, potassium. Those 3 are the main ones, and then you definitely need to supplement with the other 87 until you feel the symptoms going.
Yes,
Yeah.
yes. I was gonna see if y'all wanted some water. Yes, I got you.
Just trying to get your attention.
Yeah, go on.
I'm sorry, I couldn't hear. I'm sorry. One more time.
What if you have like medical thyroid?
I would.
I know your thyroid
Yeah,
controls
that's
many
exactly
Ooh,
in the
okay.
body, so you don't have your whole thyroid
I would have to ask about. Do you have a thyroid gland or no?
I have no thyroid.
Okay, yeah, I'd have to ask about that too. I have no idea. Honestly, no, I have to
I
check.
have hypothyroid, but I only have a little part of my left thyroid, and I also had parathyroid where your calcium goes in your blood, but they took that part of my parathyroid out also.
Ooh, yeah, it sounds like a lot of the things are going to be calcium related, and because calcium and magnesium work together, that's going to be probably deficiency. And I think 8. Let's see what the numbers are. Of how many people in America are
Is this one?
calcium deficient?
you
You know,
Thank you. Yes, yes,
He
yes.
says to you don't have it.
let me see.
Some doctors say, oh.
Spruce, are you there?
Hey there.
What percentage of Americans are magnesium deficient?
Wait, water.
Spruce, did you hear me or no?
Do we order through you or on you? I mean,
Oh, he's talking on my earpiece. My bad, Spruce.
okay.
I'm sorry. Could you repeat that? What percentage of Americans are magnesium deficient?
So it varies a bit, but generally somewhere between around 2.5% and 15% of Americans are actually magnesium deficient. And if you look at it more broadly, up to about half of people might not be getting enough magnesium in their diet in general.
Okay, so there's a difference between like morbidly magnesium deficient and just not getting enough. But that's 50%. That's enough. Especially if you already have some other issues like with calcium, that'll compound it and make it worse.
I heard a doctor saying that 99% of
Yeah.
heart surgeries could
I have
be.
another question. I wonder why doctors don't really test for vitamins. It seems like when they do,
Yeah.
it's always
Yeah.
vitamin D, usually D3, and vitamin B12.
Yep.
They're not testing for these in your blood work.
Well, when we go, me and Edie get that hormone supplement, like then we get the pellet,
Yeah.
which is
Okay.
like, you know,
Biotin?
slowly, Biotin is like
Oh,
slowly
Biotin.
dispersed, right?
Okay.
And that doctor, well, she's not a doctor, she's a nurse practitioner.
Yeah.
She tests for all that stuff, and then she sits there and
She's
tells
like,
you,
oh,
like,
you need to
you're
take your
deficient
vitamin
on
D.
this, and
You need to take
Yeah.
this.
My
You
doctor
need
does the same thing,
Awesome.
but they are not testing for the same thing.
Yeah.
Because this nurse practitioner is like,
Health.
that's what she's
She wants
focused
hormone
on.
health,
She's focused on like how you are, like you know about
Hormone
your
health,
chromium
yeah.
and all that.
So let me ask this. I'm just curious. So the doctor, they probably operate with insurance plans. Is the nurse practitioner using insurance, or she's
Yes.
gonna pay? She's insurance.
Well, we
too?
pay.
No,
so
she says
so
she does.
her the blood work is covered by insurance,
Uh-huh.
but we pay her out of
Exactly.
pocket.
Oh yeah.
Yes, we
See,
pay her
so
3 to 4 months.
The
We go 3 to
insurance
4
company
times.
is not going to pay
Yeah.
the doctor. They're only going to give you the test that the insurance company is going to compensate
Right.
for giving. So if it's 12, if vitamin B and vitamin D, that's what doctor. Now if you pay them out of pocket,
Yeah, we're paying her out of pocket.
that's why they get
It's
you all
like,
the good stuff.
It's like say $350.
That's why you're getting the good test.
3 or 4 times a year. Yeah.
Vitamins. And when you say you're tired, like I say I'm always tired. Like I can fall asleep in the middle of the afternoon. I get extremely tired. I'm not a lazy person.
Mm-mm.
I get
She's
up.
not.
Like today, this is the first time I'm actually sitting because I'm listening. But I just think if I say I'm tired, and then it's not my norm, why are they like, oh, okay, well, I
It's
don't know.
age.
I just
You know.
feel like you get nowhere with people.
She's right though. She's right.
So
Yeah, yeah.
so we can definitely start on this.
Because they just want to say,
Yes.
oh, what's wrong with you? Here, take this, take that.
Instead
It's
of
like
hey,
a- it's
let's
like a-
focus on health.
If they gave you
like
something
a checklist.
that would make you not tired
I
anymore,
might not literally
You would need them.
wait.
We would not
I'm
need them.
constantly moving. I
You
know
can't
that
move
it's better
anyways,
to
yeah.
move than not to move, so. I really don't get it.
She doesn't sweat.
Yeah, no, I would
So
recommend
she,
trying.
so she may be at a different level than me.
I do, but it takes a
Another thing they
lot.
don't tell
It
you,
takes a
when,
lot.
when you
I
get a
sweat all the
prescription
time.
drug or
So-
you get something from a doctor and it doesn't work or something happens, they are not going to refund you
Right.
at all. Our products have a 60-day empty bag money back guarantee. If you start taking our stuff and you don't feel exactly how you're supposed to feel within 60 days, you can
That's a
send
good
like literally an empty bag and you'll get your
you
money
cold?
back, no questions asked. Just send the empty bag. Yeah.
is
Nobody
the
ever
best
does it, but we
No,
offer it.
it's not. But what y'all building is reputation,
Oh yeah, for sure. No,
It's what you're
we-
building.
We believe in
We
that
do-
stuff, and
yes.
we want people to really.
and I
get
can't
what
wait
they
because
can
we've
today.
been. I know you cream. I put that on
Oh,
multiple
it's
times.
amazing, right? Yeah, I
Man,
people,
I got a
people
permanent crick in my neck. Like
No, I think
I'm
about
trying to.
medications. Do I have to watch what I take, everything?
Yeah, so what I would do, especially if you're on medications,
I'm so sorry. I'm
you
so
can
sorry.
always look at the ingredients and see if there's any contradictions, or you
Can't
can
even
just
help.
ask your doctor and say, hey, this is some all natural supplements, based off plant products. Is it okay if I take these or no? What I do know offhand though is going to be that the black seed oil, it just does such amazing things for the blood. It will mess with the blood thinner for sure. But I would check everything just to be safe. We always want to be on the safe side regardless. Yes, ma'am.
Okay, so go ahead.
I do have a couple of people who are on blood thinners.
Oh yeah, okay.
Who are on black seed oil.
Really?
We just have them monitor their blood work.
Okay.
And the doctor, make sure that the doctor knows you're taking, hey, can I take this safely? And because I'm on blood
What did
thinners,
you do if it's not safe? What?
He'll
Then he will
let
say
you
no.
know.
Yeah,
He'll
he-
let you
The
know.
doctor
Say
will.
like, don't do it.
He will say, do not do that.
yeah.
He will definitely say, nope. It will not
Yep.
mix with what you already take and what you're on.
Yep.
I have a lady doctor.
Yeah,
Oh,
she'll
good,
be great,
good,
great,
good.
great. Yeah.
Yeah. Yes.
So my mom, this was recent. She say 6 weeks ago, her doctor put her on her bones, the calcium in her bones were getting less or whatever.
Yep.
So he put her on a pill. And she had to take it daily. But what it did was, all her muscles in her legs were killing her. And like, so she could get down in her chair, but
Right.
she couldn't get up in her
What
chair.
kind of pill is this?
I don't know. So she stopped
God.
taking it after 2 weeks, 2 or
Good.
3 weeks. She was
Good.
like, put me on something else if you want my bones to get stronger. But I cannot get out of my chair. It hurts me to sit on the toilet. Like, cause these muscles
Yeah,
were
the
killing her.
quadriceps. Wow.
What is that doing to me? So I was thinking, could something here help her to build stronger muscles and not be physical pain to her muscles? She had to start, like, she walks. She's like, I had to take a couple of days off, and now I'm starting again and going slower because what it did to my muscles.
Right.
But it was only in the bending and not in the, once
Well,
she's
the-
up,
the-
she's
the
fine.
flex position, yeah,
Yes.
with the stress on it right there. So what I would recommend for
the
that,
heck?
because that's more acute,
Uh-huh.
is three things. Number
Okay.
one is going to be water.
Okay.
And the reason why, because muscles are 70% water. So whenever you have a muscle issue, I always tell people, check your water. Make sure you're drinking about half your body weight in water a day in ounces. So if I weigh 100 pounds, which I most certainly do not, but if I did, I need 50 ounces of water
Okay.
a day until that pain starts to. That's the most important thing.
I know
The-
you tell me to drink a lot of water.
Yes, ma'am. Water is so important. The human body is over 80 to
But
90%
sometimes it's
water.
hard 'cause
Yep,
it doesn't
yep,
taste
yep.
good.
And it doesn't even make sense because I'm like, we're so solid, but no.
We're really.
Water, yeah,
Okay.
it's a thing.
Okay.
The second thing I'd recommend is to make sure that her protein intake is up. And that can be anything from fish to a good steak, or if she's vegetarian, she can do a protein shake. Oh,
Not
okay.
fish steak.
Needs some meat. Definitely need the meat. And because the other part of the muscles is water, the other part's going to be that protein component. So we have
Okay.
to make sure they have enough raw material to be good. What are you saying?
What about those protein shakes itself?
Yes, protein shakes are okay. Yes, ma'am. Yep. Sometimes they're easy to get down, more
who is that,
convenient. You
Edie?
don't
My
have
mom.
to cook them.
Oh.
And if you need
And she was like really in pain, like for a couple of days.
the last
like
thing
days.
the last thing I would mention of that is actually just going to be calcium off Amazon. Calcium off Amazon, $11-12. Yeah. Let me make sure I got the right kind for you because there's
So,
several, but
could-
only one kind of body absorbs.
Right, that's what I was saying. Like maybe she was taking the wrong thing. Whatever the test showed, her density, bone density.
Yes.
And so like,
That's normal.
if we
Okay.
could tell
That's
her
what
the
they
correct
told me
type,
to take a
Yeah, that's what
ball.
I'm doing right now. Yep.
because
Yep.
she drinks too much Diet Coke,
Water
not enough water.
Well, that'll do it.
Stop
That'll,
it.
that'll do it to you. For
Yeah, I
sure.
know.
Yeah, that'll do it.
She'll say it right there. She's like, "Your mama's gonna kill herself," and I'm like,
You
"But
know?
if she knows,
Yes.
Is
okay."
this like a probiotic or this is really really just vitamin supplement?
Yep, no, probiotics are gonna be in that gut check one, yeah.
Gut check, yes.
No,
else is that?
gut
Yep.
check is that one.
Oh, here it
Yeah, right here.
I can have that one,
Is
I
there any
have
way I
several.
can give a kid
Yay.
Yep.
to me?
Yeah, so
Super
gut check.
Probiotics.
We'll
so
take a picture of that
important.
one? Or you did already for
Oh
her?
no, she's asking for like the website or a
Oh,
catalog
okay.
or something like that.
Oh, yeah, Lily and Bush can get it, yeah, she can get you to the website, so she'll get you taken care of.
Or we can like, do you want me to take a picture of what he said if you took like
The
the,
power pack?
could you do that?
Yeah,
Let me
like-
see that, little scoopy.
Just do like this. Is it this,
Like, yeah,
this
like,
thing?
it was like 4 things, hold on, let me take
Yeah.
a picture.
Oh, this is not, it's not this one.
More than that, it had like.
Oh, this one black, and where's the, oh, sorry, where's the iodine? Yeah. So that itself. I'll put that one.
I was, well,
No, this is if she
Oh, it's
needs
extra,
gut
extra,
check. Do you
extra,
have a
okay.
gut check problem?
not really.
If,
I mean,
if,
I
if
sometimes get that.
the people I would recommend, for gut check is only, not people who have gut issues, but if you've ever taken any antibiotics of any type ever, and never took probiotics to replace your intestinal gut health, that's gonna be.
She's the one who had the surgeries and the
Yeah,
spiral
yeah,
fracture.
gut check is only taken for about a month. That's not something you buy every month.
Okay.
For example, when I had I had antibiotics or something years back, but I didn't realize it destroys. The antibiotics are good. They destroy all the bad bacteria. They will do their job. The problem is they destroy all the good bacteria
Yeah.
too, which lives in your gut, and you got to put that back.
Good.
You only
And
got to put
then-
it back one time, and you don't need to take gut check again unless you have another round of antibiotics in the future. Yes, that's all.
So what's the,
I did it,
what's the website?
it's probiotic.
Yes, ma'am.
Yeah.
Yes, ma'am. Probiotics is in that package. Yes, ma'am. Probiotics and prebiotics. They're very
It'll
good.
be www.hbnaturals.com/.
Wait, do a-
You want me to text it to you?
Oh, yeah.
Yes, please.
Yeah.
Please, please, please.
766-344.
Yes.
Or she can go to
I'm texting it right now.
I think you sent it to me already.
Little
I should
Health
just-
Food Store.
Oh, yeah, sent it? Okay.
I like that. Little
Yeah,
health
let me
food
look,
stuff.
'cause
Little health food
you
store.
sent it to me,
Yeah.
remember, before
So-
I bought the cream.
So,
Yeah.
yeah. If you could tell me the right calcium, I'll buy that for my mom and she can start taking that.
Okay.
And then we're gonna have to
Remember you sent
hold her
me-
down and
Oh,
tell
you know
her
what? I was
more
cleaning
water.
my phone one
Oh,
day.
yeah.
More water. Because I know she eats, I know they eat steak, chicken,
Good.
fish, they eat all of that.
But
Like the water.
even with the Diet Coke, if she just even has a 1-to-1, because Coke isn't inherently bad. I love a good Coke. But the water is needed to flush it through the kidneys,
Yeah.
flush it through the liver. Otherwise, that stuff will sit. And you know,
Well-
Coke will dissolve a car battery.
Right. Oh my
Yeah,
God.
it's
Yeah.
strong.
So
It's
here.
strong.
Well,
So
that's why I water my Coke down with Bacardi.
Yeah.
So it's not so like
oh my God.
corrosive.
Oh my God.
I'm
Okay.
originally born from the water, so you know, I can appreciate it. I can appreciate that yesterday.
Well, another thing is she has this big old thing.
And I go offshore and I have a Coke. Like I'll have like I'm not a big soda drinker. I don't
Yeah.
drink soda. But like pizza night,
Oh, love pizza night.
there's
Yes,
certain
yes,
things
yes.
you'll have it with, which
Yeah.
is basically pizza night and that's it, right? I'm offshore and I'm like, oh, it's pizza and wing night, right?
Ooh, yeah.
I like grab a Coke and I take a sip. I'm like,
It is
Jesus
super
Christ, how do you
sweet.
people drink this
Oh,
shit?
and they do. Oh,
How
man.
did it get
And the
in?
Diet
It's
Coke's
So
even
strong. It's so
sweeter
strong. I know.
than
Huh?
the Coke.
Thank you. Oh my
She
God.
was asking something else, but I couldn't hear her.
I'm like, oh my God.
I see what she was at.
Sisters talking.
Hey,
I
your water
don't know if you're gonna hear
I'm
her.
gonna use that
Okay,
next time.
hold on.
So I'm gonna give you credit
She's
for
on
next
a roll.
three meetings I do, because I'm gonna say that after number 4. It's mine now. All
Hey,
right, I'm gonna give you
there's
credit
so,
for that. I got it.
God, there's so much
You
good
had
stuff.
another question.
So
Oh, I'm
much good
sorry. Yeah, we
stuff.
got-
That's got another
oh.
question.
Yes.
See that.
Okay. Ask your question.
Yes. Hello. Hey, hello.
Talking to Legion.
Mm-hmm.
Yes.
Well, I asked about the probiotic, but now I forgot the next.
Okay. No worries. No worries.
Oh, you know what I wanted to ask about? That ointment you first talked about.
Black seed.
Is
Oh, the
that
black seed oil.
ointment, like for pain, like that you just rub in?
Ooh.
So
Oh,
black seed
no,
oil
no,
can
no.
be used topically, but we do actually have a pain cream
Oh, yeah.
specifically for that. Jennifer, did you try that before? Who's
No, I
tried
got
it before?
it. No, we got it. Awesome.
Oh, me.
good, yes,
Oh,
yeah.
wait.
So
Hold
we
on.
do have a topical pain cream
That'd be
that
called
they have here right now.
Rosemary essential oil. Oh no,
Oh, no,
or is it
she
the?
was asking about black seed oil for pain.
I think that black seed oil is a very good thing for fibromyalgia.
Oh yeah, internal for
Because
sure.
you're looking at inflammation. And black seed oil reduces inflammation
Yes.
in your body.
Okay, so here.
So that,
Yes, we're gonna get her that for sure.
Yeah, give it a, yeah.
For
on-
sure,
on-
for
on the
sure.
house, enjoy it.
Look, we
I
got
gotta take a
that.
picture of this.
And then maybe she was talking about.
Wait, Edie.
Oh,
He said that we put the drop in there under his tongue.
yes,
start.
a dropper full.
Let me take a picture.
well,
of
a
that.
drop to
Just one
start
drop.
to get used to the taste.
Yeah, that's what I did.
Yeah.
Yes,
Basic stuff.
to
Yeah.
start to get, and I took notes, so I can tell her later. I can refresh her on what to do.
Well, yeah, and I can send you these too. Yeah.
Please, because like the drop might help us to get used to the taste.
I know.
I
Then
sent you a picture, Pat, of the black seed oil, what it looks like at least.
I think she needs this one.
Don't they
This-
go together?
Oh, they have
So this is the one,
This is what we need here.
this is the one that me and Edie got for like,
Like, oh my god, I
It's
put
like
it
a-
on
it's
twice,
like a
3 times a
cream.
day sometimes. And what's in there? If you could tell me, what?
Magnesium.
that pain one is
Magnesium.
like,
Okay, because man, whatever it is,
like a,
7,500, 75,000
and I
milligrams.
can feel it. It almost warms as I
which
put
one
it
has
on.
the THC?
75,000.
Oh, no, I was
So
gonna have THC.
this
I was
is
using
like that,
THC
but
as an
on
example.
steroids?
Yeah, that's an example.
Put them both together.
I want that.
I spray both of them.
Can you?
Yeah,
Okay,
yeah,
hold
we're
on.
going
I'm
to
writing
the-
what I
the
want, and
essential
so I want
essential
this.
oils
So
in case you want.
like,
Now, when you used to